All right, so I have another point I just want to talk about regarding the whole live streaming at work as a nurse. And why I am going to talk about this is because I was trained in Jamaica, and when I was in training, we weren't allowed to be using our cell phones. We weren't allowed to like sit. You always have to get active and be doing something. And that was something that I really appreciated about my program or my training, because those preceptors, the nurses that you were with on those floors, they were always pushing you to learn. So with this issue going on now with the live streaming nurse and some of the implications that could occur or result from this, I'm just looking at the fact that when it comes down to the hospital setting, a lot of hospitals are going to be implementing more cameras at the nurses station. It's going to make you feel uncomfortable. They're going to have more rules regarding cell phone use. The policies are going to be enforced a little bit more than usual. And you're going to feel like, your privacy at the nurses station is going to be a little bit violated, because at that time, usually it's a little bit of a downtime for us, even though we might have patients, because sometimes you might be seeing patients, but there's nothing much going on. So you can be able to chit chat, you take out your little phone and you kind of be doing one and two things, responding. But with this whole, saga going on, I just feel as though that's gonna be like, a no. We're not gonna be able to freely discuss what we usually talk at the nurses station in those low tone or, quiet times, and just kind of still have some sense of humor while we're on the job. I don't know if you understand what I'm saying, but usually, even though you might have patience, we might find time to sit down and laugh about something. So no, I just feel as though there's going to be more camera. We're not going to be able to use our phones. Sometimes you can sneak in a little cell phone call to your family member just to check in. So all of those things are going to change. And I know a lot of persons are going to be very uncomfortable. But the one thing I love about this whole, live streaming saga that is going on is the fact that when it comes down to our nursing students, I feel as though they are going to be a little bit more like connected with you on the floor when it comes on to learning. Because when I was doing precepting here, I never really enjoy it, because every time you ask a question, the only thing the nursing students are going to be doing is picking out their phone and they go on to Google and they're telling you the answer. They're not sitting down and thinking about what is going on. They're not rationalizing what is going on. And I used to hate it. I just used to hate it, because if you say to them that, oh no, I don't want that answer, or explain it, they cannot explain it, you understand, just because they have their phones at their fingertip. And because of that reason, they are not sitting down and trying to reason out what is happening with a patient condition, why this test is needed for this patient, why we're managing the patient in the manner we are doing. And so in terms of critically thinking, their critical thinking skills, I feel as though it wasn't really, improving. Because sometimes, when you talk with some of these students, especially when they graduate, some of them are like fourth year students and you're precepting them, and the level of thinking at that time was just not impressive for me. When you talk about persons who have graduated, it's the same thing. Now, for example, the management of chest pain. A lot of persons never really understand the management of chest pain, why you're doing a troponin, all of those things for a new grad. It was just a little bit sad. And it was just not something that I was happy about, because I'm looking at it to say these persons are going to be taking care of patients on their license. So they're going to be prone to more risk and errors and, more lawsuits, if you want to just say it or think it. But I am happy that, know if depending on what is happening with our nursing students, we are going to have to go back to getting dictionaries. We're going to go back to working with textbook, so we can actually sit down at the clinical site and go through certain conditions. And I feel as though it's going to help them be prepared a little bit more, because at that time, when you ask them something, the only thing they can do is go to the textbook. Go to the textbook and read it through. You're not going to go on Google and pull up information just because it is at your fingertip. Yes, we wanted to pull up the information because it's at your fingertip, but during those times, I just feel as though you need concrete knowledge. You need to make sure that your knowledge is broad. You understand exactly what you're reading and you can actually talk about it, explain it when somebody asks you. Nursing students are not going to be using their cell phones at work, because in those areas, more than likely, they'll be implementing those cameras. So everybody's going to be a little bit scared to use it. I'm just thinking about the overall preparation for the nursing student. I feel as though it is going to be something that is going to bring them closer to their bookwork. It's going to bring them closer to understanding, rationalizing certain things. The other thing is that usually some of these student nurses, they'll be sitting on TikTok all day. They come to clinical side and they'll be sitting on TikTok all day at the nurse's station looking at you like this. And when you ask them something, it takes them forever. If you tell them, okay, I don't want the information from Google, just explain it how you can. And you have to tell them, just don't look at the phone. You understand? And sometimes it's like they're just so sucked into the internet that they are not able to explain anything. So as I say, it's going to cause a lot of changes in healthcare, and a lot of persons are going to be uncomfortable, and I am going to be uncomfortable as well, because if I am back in the hospital working, I'm not going to like those implementations, because I've seen hospitals where they do have the cameras. You can't really munch on a little, bar when you're hungry or when you're super busy. You can't do any of those at the nurse's station. You have to actually step away and go to the nurse's room and eat something. So things like that I understand. But if you understand what I'm saying in terms of the preparation for these nurses, I think they're gonna be a little bit better in terms of being hungry to learn. They're always gonna want to probably go out and try to see, what is going on, and be a little bit more involved, knowing that the cameras are on them. So in that aspect, kudos to the nurse who went live streaming, because you probably spent a lot of time on the internet during nursing school, and there were critical things that were missed. And I just feel as though if these things were implemented where no cell phones was allowed, especially for our students, then definitely I don't think you'd be in a situation where you would be, investigated right now for something as silly as what you did with the live stream. I'm just saying, that's just my take on it. But this video is just to bring across the point where, as a preceptor here in the US, I was never impressed with a lot of the students that I was precepting. And because of that, I am just thinking that there is going to be a different way of thinking. The actions of these nursing students are going to be a little bit different. And so when they get out into the nursing world, they'll think a little bit more, smarter. They'll make the right decision. They'll be a little bit more critical in their thinking and their decision making. And the overall, care of the patients will be better just because of this one little incident. There are so many lessons that you can actually take away from this one event. And unfortunately, she's in a situation where her license is at risk. But, sometimes we always say, if you can't hear, then you will feel. And I just think that was the situation for her. All right. But I do hope that whatever it is that the outcome for this situation is, it is something that she will learn from. She'll be able to move on, get a job, if it's a RN, LPN, whatever it is that she's able to do to still make a living. You understand? And that's all I'm gonna say. But definitely for the nurses out there, just be careful, because you don't know what's gonna be happening later on. So just go ahead and think about it. And as I said, this is nothing to bash anybody, and I'm not in agreement with the hospital policies that are going to be implemented around this. But I'm just saying, you have to understand from my side what I think is going to happen when it comes on to these student nurses at the clinical sites. Until then, I'll see you next.